is Yaman Sorry. I am the chair of Valley Clean Air Now. I am, very excited that tonight is actually happening because it's been a long time coming, to get this information out. So Valley Cleaner Now is a small community organization, and we reached out to the Agency for Diseases and Toxic Substances quite some time ago and asked them to do a community health assessment. Obviously, a lot of us that live in the Mon Valley are sick. We know that, if you live here, you have a 60% chance of getting cancer. And so we wanted to bring the federal government here to, help us identify what was going on. And so we reached out to them and they accepted our petition. And this is their first presentation to the public about this health assessment. We have Nathan McCrae, who is going to introduce himself in a little bit, but he's from the PA Department of Health. They're the main authors of this health assessment. And they're going to be talking about the process of it. And, they really want to hear community concerns at the end. So what I'm going to do is I'm going to pass it off to Nathan here in a second. And what I'm going to ask is that you have a question, which we're going to have time for in the end, that you just put your name and where you're from in the chat. And we will use that as the list to start our questions at the end. So with that, I appreciate you guys listening to me, and I'll pass it off to Nathan to introduce himself and get us started.
Hey, thanks a lot, and Kiam, and I appreciate you all and VCAN for allowing us to talk to you today. I'll just briefly introduce myself, and then I'll turn it over to my colleague Julie Miller. We're going to be the ones primarily speaking today. We do have some other folks listening in too, but my name is Nathan McCrae. I'm an epidemiology research associate here with the Pennsylvania Department of Health. I've been here about 2.5 years, and I am based in Harrisburg. So I'm part of our apple tree program, and I'm going to tell you all about that program in a minute. But with that, let me turn it over to Dr. Julie Miller, who I'm sure you all know pretty well too. So Julie.
Hey, Nathan, thanks. I'm Julie Miller. I'm the public health toxicologist for the Pennsylvania Department of Health, and I'm actually located in the Pittsburgh region, in the Mon Valley especially. So this health assessment is something that is very of interest to me, and of course, very near and dear to my heart. So it's something that, I've been monitoring as a citizen and also as a scientist. So it's something that I really look forward to hearing everyone's health concerns during the course of this meeting. But specifically, Nathan will probably get into it quickly, but what we mainly wanted to provide is that, while the petition was sent to ATSDR, or the Agency for Toxic Substances and Disease Registry, Pennsylvania Department of Health, in our Division of Environmental Health Epidemiology, is the cooperating agency fulfilling this request. So that's why you see the Pennsylvania Department of Health here. With that, I will let Nathan get started on the presentation regarding our health assessment.
Yeah, sorry about that. I'm back. You all hear me okay?
Mm-hmm.
Okay. With that, let's get started then. I'm going to show you a slideshow and hopefully talk for maybe about 20 minutes or so. I know everyone's probably sick of slideshows, but hopefully I'm interesting enough. So let me just see. I need to make sure I'm doing this right. Okay. Can everyone see that okay and hear me okay?
Yep, I can see them, Nathan.
Okay, thanks. All right. So hello, everyone. Thanks so much for being here today. My name is Nathan McCrae. As I mentioned, I'm an Epi Research Associate and Health Assessor. I'm joined by Dr. Julie Miller, and we're with the Apple Tree Program for the Pennsylvania Department of Health. And I'm really thankful to VCAN, to you all, especially your leadership, Tom, Fred, Kiam, allowing us to speak today. This is my first time probably, speaking and meeting a lot of you. So thanks for the opportunity. So yeah, we are conducting a health assessment for the Clairton Coke Works site with the goal of determining whether chemical levels in the surrounding communities are potentially affecting health based on the environmental data that we have. And we're going to tell you about our process and how we work on determining this. And we are still in that process. We have no results at this time. So we have no, we're not sharing any results because we have no results at this time. But we really just want to provide an overview of who we are, what we're doing, why we're doing it, and how we're going to go about it, so that you kind of know, the process that we're going from. And then we definitely want to hear from you too, because community concerns in aggregate are part of these health assessments, and they're documented as part of these health assessments. And so they're an important part too. So, we're glad that we have enough time to hear from you after we're done presenting. So who are we? We are the Department of Health's Apple Tree program. It's a long acronym. We stand for ATSCR's partnership to promote localized efforts to reduce environmental exposures. So what is that exactly? Well, we are a state partner of the Federal Agency for Toxic Substance and Disease Registry. They're housed within the U.S. Department of Health and Human Services, and their headquarters in Atlanta. And they're the agency that works to minimize human exposure to hazardous substances in the environment. So we're a state partner of ATSCR, which I'm sure a lot of you know who ATSCR is. And 30 states have an apple tree program. So Pennsylvania is one of those states. And our program was established in 1989. So, as you all know, Pennsylvania has a history of, environmental contamination. And that's what we work to do. We work to evaluate site contamination, in air, water, and soil, and the potential for health effects. So as it shows here, on the slide, this is done in response to community concerns or agency concerns such as EPA or DEP. And we typically don't collect our own data. So we use data that is collected by other agencies. And then we use ATSCR tools to assess the potential for health effects based on the data that we're seeing. And our end product are reports, our health assessment reports. And I'll go into that in a second. We are non-regulatory. We do not have regulatory authority. And it's a small team of us. So it's myself. I have one other colleague, a health assessor colleague, and then Julie Miller is our program lead. So we assess, we assess multiple sites, and CCW is one we are assessing. But here's what we produce. So, what do we produce? We produce these health assessments, and they come in various forms, but these are the three that can make health determinations. They're called letter health consultations, and public health assessments. All these types of reports are public health assessments. They assess health. They are in a little bit different formats, but we are working on a health consultation, which is an example that you see here in the middle for this site. So health consultations and public health assessments, they're comprehensive documents that look to determine, again, whether or not the data that we're seeing shows a potential harm to health. So these are longer documents, and we can consider, they can consider outcome data such as cancer rates. So they're a little more robust than the letter health consultation that you see on the left there. And in the program's history, we've developed over 200 of these types of reports for various, sites, throughout the Commonwealth. And, if and as needed, we make recommendations in these reports to prevent or reduce exposures to air, water, soil, etc. This particular health consultation that we're working on will be a certified document, which means that it goes through ATSCR headquarters in Atlanta after it goes through review stages with us. So, and ATSCR Region 3, I should say. So I'll talk more about that later. So why are we doing, a health assessment here? And, it's because of, the work of you all and VCAN. VCAN petitioned ATSCR for a health assessment. And, this then launches a process in which we all look at, environmental data. We look at the site history, things of that nature. and see if there's enough environmental data to produce a health assessment. So this is a process, and from that process, there's a petition summary document that's created. That petition summary document was reviewed, and then it was all accepted. So this is probably you all know this, but because we're the apple tree, we're the state apple tree partner of ATSCR. The Pennsylvania Department of Health takes the lead in preparing the report, but we do have guidance throughout, which is terrific, from ATSCR Region 3, which is they're based in Philadelphia, and so that's terrific. And then again, this is a certified report, so when it is ready for public release, it'll go through DOH review, and then it'll go through ATSCR review, and then it gets that extra layer of review from ATSCR subject matter experts, additional subject matter experts in Atlanta. So we are doing a health consultation for this site. It's certified, meaning it goes through ATSCR headquarters as a final step. So what is a health consultation? And some of this might be review for a lot of you, but I just want to kind of explain the process so you know what we're doing. That's kind of the core of why I'm here today. But what we do is we look at the environmental data that we have and the potential for health effects from a site of concern based on community exposures, for example, to air, water, or soil, depending on what environmental data is there. Now, we look for the potential for cancer and non-cancer health effects, and I'll explain the process we use for that. And again, these are usually longer reports, and they can take months or years to complete before release. Final release is accompanied by shorter versions, though. And again, they can consider health outcome data, such as cancer rates, and they have these other components, which I'll explain in a second. But if you're interested, and I'm sure some of you probably have maybe seen what a health consultation is, you can if you're interested, you can look online. ATSCR produces them. State Apple Tree Partners produce them. We've produced them in the past. But these are kind of the components that are there in a health consultation. So they're going to be in ours too. These can be long documents, but we'll have that summary at the beginning. So if you just want to read the first page or two, you'll get the gist of the rest of everything through that. But they also include a site background, site history, recent and long-term, site maps, where the site is located in relation to the communities, etc. But again, there's also this community description and concerns section that's included in the health consultation. So it's documented as we try to, and it helps us write the assessment. So that's why too, like, we hope we can hear some of the concerns, health and others that you might have. And then it'll talk about the methods that we're using, the sampling data that we're using. And I'm going to talk about scientific evaluations, how we determine the potential to harm health, along with these other things. But the thing about these health assessments are they're very deliberate. In the report itself, it'll tell you what we're going to do, then we do it in the report, and then we explain our findings. So it's a very deliberate process, a step-by-step process, and that's kind of the core of what are in these documents. And I should say that our methods that we use are all online. We follow the ATSCR Public Health Assessment Guidance Manual to do these assessments, and I'm going to focus on number 6 today. How we conduct the scientific evaluation. But you can look at this guidance if you're interested, through this website here. And we will share the slides too. So just so you know. Okay, I'm going to talk about that scientific evaluation, kind of the core of how we determine, the potential for health effects based on the environmental data that we're seeing. So, some of this might be a little obvious, but, we just do it. We do it in all of our documents. So, just to kind of give you an overview, it's a step-by-step process. So once we determine, we find out the data sources and the data quality, we conduct what is known as an exposure pathway analysis. And again, this probably seems, evident, but we look at things like, the source, and then, how chemicals that are emitted from the source transfer, move through the environment, and how they come in contact with people. And are people breathing them in? Can they be exposed dermally? Through ingestion, etc. So, once we determine that, and that we determine that exposures are completed or potential, as we say, we then move on to the next step, which is seen here at the bottom, which is identifying exposure units. So this is really just a geographical area of where people are in relation to the site and how they're coming in contact with the site contaminants. And so an example might be, say there's a site hypothetically where we have, and exposure units can vary from site to site. So say, for instance, there's a site where there are 35 soil samples at 35 different households near a site of concern. Each of those households in that case, would be its own exposure unit, right? Because the one soil sample might be independent from your next door neighbor's soil sample. So that's one example of an exposure unit. In another scenario, an exposure unit might be, for instance, a community or neighborhood that is near an environmental monitor that is monitoring for contaminants in air. That might be another exposure unit. So these are kind of these geographically defined points or areas that we use, and it helps inform our exposure assessments. So that's the next step. Then we do exposure units, exposure pathways, and then exposure units. And then we do the screening analysis. So within each of those exposure units, we screen chemicals in their contaminant concentrations, again, based on the environmental data set that we're reviewing against ATSCR, what are known as ATSCR comparison values. So these are screening levels, and we usually, as a precautionary approach, we'll take the highest value, or if we got a lot of data, the values on the high end, and we'll compare them to the ATSCR comparison values. And what this has done, we all know chemicals can fluctuate, right? And we might have, say, 2 years of a certain chemical, but we'll take the higher reading and then determine whether or not we're keeping it for further evaluation to move on to the next step. So this screening process helps us narrow down the chemicals that we call potential contaminants of concern that we further evaluate. So, say there are 50 chemicals, and hypothetical scenario, 50 chemicals that we're reviewing. If say 8 of them exceed screening values, we will take them on to the next step. Now, exceeding a screening value doesn't mean that that the chemical will harm health. It just means we move on to the next step, which I'll talk about in a second. But we do label it a potential contaminant of concern, and then we further evaluate them. We also incorporate chemicals that are community concerns. So if it's in the environmental data set and they're community concerns, whether or not they exceed screening levels, we will call them contaminants of concern and evaluate them. We also evaluate any chemicals that lack a screening value. We also include them as contaminants of concern. So that's a screening analysis, and it helps us narrow down from the large data sets that we often see which ones require further analysis. So then what do we do? Then we work to estimate exposure to these contaminants, potential contaminants of concern. And so these are an estimate of community exposure. And this is important because we really want to gather short-term, intermediate, and long-term exposure. So we do that for each contaminant of concern. So if there's a dozen, we'll do this for each contaminant of concern. And that's important because, sometimes at a site you might find, for instance, a contaminant might produce acute health effects, but not long-term or year-long or longer health effects. It might just be a shorter-term health effect. Or you might find the opposite. You might find a chemical that might be a concern for maybe longer-term exposures, but not shorter-term. But for each contaminant of concern, we estimate all 3 of these levels because, they can happen, whether or not you're a resident, a long-term resident, or a visitor. You can have all 3 of these in theory. So we take a look at that as well. And again, all these terms that I'm mentioning, they're all online on ATSCR's website. It's called the Public Health Assessment Guidance Manual. So you see here, exposure pathways, screening analysis. Now I'm going to talk about these next 2 steps here. So that's the goal. We estimate our exposure point concentrations, our exposure estimates, but as a whole, what we're trying to do is determine if exposures to each of those potential contaminants of concern are happening for long enough frequently enough and at high enough concentrations to result in harmful health effects to a nearby community. So that leads me to the next step, right? So we then, for all those potential contaminants of concern, right? We have our exposure estimates representing short-term, intermediate, and then long-term exposures to each of those contaminants of concern. So what we then do now, there's different kind of methods, right? For non-cancer health effects and then for the potential for cancer risk. So I'm going to talk about non-cancer health effects first. Okay, so for non-cancer health effects, we compare those short-term, intermediate, and long-term exposure estimates that we made to EPA and ATSCR health guidelines. So, again, some of this might be review, but you might have heard of things such as minimal risk levels. That's the ATSCR health guideline. EPA for air has something called a reference concentration. So these are, we're all exposed to chemicals each day, right? For non-cancer, a lot of chemicals, not all, but many chemicals have these health guidelines of the levels that you can be, that are estimates. They're based on scientific peer-reviewed data of the level of a chemical you can be exposed to each day without an appreciable risk to health. So these are these minimal risk levels from ATSCR or reference concentrations from EPA, and we compare exposure estimates to those health guidelines. If there is an exposure estimate that exceeds a health guideline, we then take a look to see if there's a potential for health effects. So we do, we look into these ATSCR toxicological profiles, which I'm sure you all might be familiar with. And then EPA has, its own toxicological reports. So we take a look at these and conduct that full in-depth toxicological analysis. So that's how we look at the potential for non-cancer health effects to each potential contaminant of concern. So for lifetime excess cancer risk, this is a little bit different. What this is a theoretical chance of getting cancer if someone is exposed to a contaminant over a specified time period. So we look at this like on a population basis. And what we do, this is only done for contaminants that are known or suspected human carcinogens. So what this is, an example of this might be, I'm just throwing a hypothetical number out there, 4 in a million, for a particular contaminant. What this means, if you were to see this in the report, it would mean that based on the level of this particular contaminant that we're seeing, if everyone was exposed to this over, a certain period of time, if 1 million people were exposed, potentially 4 might get cancer from being exposed to this contaminant at this level. But again, this is a theoretical estimate. It doesn't mean that, you will get cancer if you're exposed to this contaminant. And these excess risk estimations, they're not, a count of the number of cases in a community. It's really a way to see which chemicals are producing excess risk and, how high, the risks are. So that's in a nutshell, what we do for each contaminant of concern. We look at the potential for non-cancer health effects, and then for those chemicals that are known or suspected human carcinogens, we look at the lifetime excess cancer risk. And so, from this, we get more toward our conclusions. Excuse me. But it's important to note that, what we work, if we do find the potential for health effects, it doesn't mean that everyone that is exposed will experience a health effect. What we really determine is the potential, the probability for that health effect, because it's influenced by a number of factors. In addition to exposure, people are different, and whether or not you'll get a long-term health outcome from an exposure to an environmental contaminant, varies. But if we find the potential for health effects, we will list that in the report. The other thing to note too is that we use cautious exposure assumptions. So we estimate exposures, kind of on the high end. If we have a lot of data, on the higher end of exposure. If we have a limited amount of data for a chemical, we'll use the maximum to estimate exposure. So, not everyone is exposed to, at all times, to the same amount or level of a chemical. So that's another thing to note and we make all this known, in our documents. But But we do note that if a chemical is not expected to harm health, we mention that. And then again, we do present, again, all these are online. So we'll consult the toxic profiles for chemicals that we're reviewing. And we'll present a little summary of each chemical that are chemicals of concern, and then our analysis to determine whether or not it can harm health. And so then we're and I'm wrapping up here. We're getting toward the end, but as we kind of finish that, we then get into kind of the end, of our report. And each health consultation will have these items: limitations, conclusions, recommendations, and a public health action plan or next steps. And so, limitations are, you're going to find limitations in any health assessment, um, uh, because there's no perfect data set. Um, as robust as the data set might be, potentially an example of a limitation might be, maybe we don't have a data on a particular compound during a certain time period. Maybe it's a past time period, or maybe it's a time period when there was a high level of other contaminants or something. So that's one limitation. Another limitation might be, maybe we just don't know enough about a particular chemical. Not all chemicals have health guidelines, and some we know a lot more than we do about others. So that could be another limitation. But on this slide are actual conclusions, the recommendations, limitations from other reports, including from other apple tree states. Conclusions are pretty obvious. We'll state what we found. I like this example. This is from the New Jersey apple tree program. This first conclusion here says, current and future exposures to copper and lead in soil at 3 of the 61 properties might harm people's health. This same health consultation found that at 32 properties near an elementary school and at an elementary school not likely to harm people's health. So the reason I like this one is you can kind of see this one, and it varies by site, but this one has different exposure units, conclusions talking about different exposure units. So that's an example of exposure units too. And then we'll always have, we'll work, we have recommendations, and we target them to, site stakeholders and community members, the sites, if and as needed. So here's an example of a recommendation. And then, the next steps are public health action plan, kind of what are we going to do next, if and as needed. And so these are examples, and they're excerpts, right? So the true health consultation will have multiple of these, probably 4 or 5 conclusions, 4 or 5 recommendations, 4 or 5 next steps. So that's just kind of the nature of these things. So where are we then in terms of, this site? Well, this one will be a large report. It'll probably be, one of our larger reports due to the amount of data that we have access to. And so we are still collecting data, and we're going to collect it through the end of the year, and then we'll launch into our analysis and our health assessment. But we are at that process of kind of data collection, but also trying to understand the full gamut of community concerns too, for our own understanding and to help inform the health assessment process. So this consultation we're currently planning for release for 2024, and it'll probably be toward the end of 2024, and that's in part to the kind of probably this will be a longer document, a comprehensive document, and then all the various stages of review that it will go through. But of course, we will present it upon release. And in the meantime, and throughout the process, we do want to hear from you. So, please do contact us. But then we do want to hear from you to follow. So the easiest way, like if you use email or things like that, is to fill out this form that we have, which will consolidate for residents of the Mon Valley to kind of track environmental concerns. Of course, if you want to share today, that's great, and if you want to do it after that, that's great too. So no pressure if you don't want to share today, and then you can always call this phone number and ask for us too. So with that, I will close, and then I don't know, Julie, do you want to share any closing thoughts?
Nope, I think you covered most of it.
Okay. All right, thanks. So that's all I have.